Hi there, it's Megan Cruson again. I want to talk about cranial sacral therapy today, and it's one of the main things that I treat in my clinic. Now, cranial sacral therapy, let's break it down with its name. So cranial meaning cranium or head, and sacral meaning sacrum or tailbone. So this therapy really is the connection between your head and your tailbone and obstructions along the way. Now, with cranial sacral therapy, the patient base I find it helps the most is my migraine patients. But I also use it on every patient that comes in, whether it be a patient that's been in a motor vehicle accident that suffered whiplash, a concussion patient, even a patient that fell on their tailbone quite a bit playing hockey as a child, or even back to when we were born in our birth and we had traumatic events happen to our head or our tailbone. Now, with cranial sacral therapy, there's three things we want to look at. So the first thing is the cerebral spinal fluid in our head. So this is a fluid that fills our head, and our brain floats in this fluid, and it acts as kind of a shock absorb system for our brain. Now, this fluid also goes down our spinal cord and goes all the way to our tailbone. So it really nourishes our whole central nervous system. So we just want to make sure there's no restrictions in this flow and it's flowing evenly side to side and down to our tailbone. The third thing we want to look at is the cranial bones and the sacrum itself. We want to make sure these cranial bones are moving properly and they're fluctuating with the fluid, as well as the sacrum is moving properly between its two pelvic bones on either side. The third thing we want to look at is cranial membranes. So these membranes surround our brain. They go all the way around our brain. They exit through our head, down our spinal cord. They cover our whole spinal cord, and they go all the way to our tailbone. Now, this membrane is a protective system. It's a non-elastic tissue. So that means when it's restricted, it really tightens everything up. It really creates that extension in our neck and in our lower back, and also causes those tension headaches as well, one of the causes at least. So we really want to make sure we're treating all three things, the fluid, the bones, and the membranes, so we're preventing any restrictions from happening, as well as resolving any pain the patient might be having.